As of today, several COVID-19 mandates have ended across Illinois.
With hospitalizations and other metrics improving, masks will no longer be required in most indoor public places, but they will still be mandated in healthcare settings, daycare centers, and on public transportation. Chicago and Cook County's vaccination requirement to eat and drink inside restaurants has also been lifted. The statewide school mask mandate has also ended, but some districts, including CPS, will still require them. Governor Pritzker says the requirements could return if Illinois is overcome by another surge.
Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good to see you in person.
So today, perhaps people think, you know what, I feel great about it. I'm not worried about it at all, but we are seeing surges in Hong Kong and South Korea. Maybe you can put it into perspective for us.
Well, they had such strict mitigations, they didn't get hit with Omicron because they had all these lockdowns and everything. So now they loosened up and boom, they got Omicron. And the same thing that happened to us in January is happening to them right now.
So people want to know, are masks gone forever? Are we at the that endemic phase now? Is this going to be like the flu?
Well, we don't know. We don't know. The thing that's happening today that's so important is the mandates are gone. The masks haven't gone anywhere. I would keep one in your pocket, and if you have any kind of underlying disease, even elderly, should really consider wearing a mask when they're indoors.
There's a report about a study that says that this came from the Wuhan market. Does that surprise you? Is that controversial?
It didn't surprise me. The data was pretty messy at the beginning, and there were all these people pushing that Wuhan lab, gain of function studies and stuff. It's all really not true. And that there were two big studies, an international one and a Chinese one, that show really it was jumping back and forth between the animals, probably two different strains at the same time.
So what do you do as a healthcare policy where a pandemic is global? There's no way for us to go to China and say, hey, maybe we shouldn't do these markets.
Well, it's probably good not to have live wild animals in a market where you're selling other
But nothing
goods.
we can do about that.
There's nothing we can do about that.
So should people be concerned, or should we breathe a sigh of relief now for the spring?
I think we should be concerned. What we need to do is we need to study all the animals. It's in white-tailed deer here in Illinois and the Midwest. It's in all sorts of animals. Cats have it. The more you look, the more you find. So it's back and forth with the animals, and that's where this thing will go in the future.
I think people want to know, though, should we still be on high alert? Is this something where we can finally take a breath for a minute?
I think we can take a breath for a minute, and I think people should enjoy it, but keep your mask handy, because if the numbers start going up, we go back to where we were.
All right, Dr. Murphy, thanks again for being here. We will talk to you again on Friday.
Great.
All right,
Thank you,
good to see
doctor. The United Nations released a new report